House Leader, third party.
Yeah, thank you, Mr. Speaker. More than 11,000 British Columbians have died from toxic illicit drugs since 2016. It's the leading cause of unnatural deaths in our province, and these deaths, Mr. Speaker, are preventable. Of all the people who use drugs in this province, less than 1% can access safe supply, according to this government's own numbers. Hundreds of thousands of British Columbians use drugs, and 100,000 of those people have an opioid dependence. This government says that saving lives is their first priority, and yet 99% of the people who use drugs, whether daily, on the weekends, or just once in a while, or just once, only have access to a toxic supply that's killing thousands of British Columbians. This government could expand safe supply and save thousands of lives, but they're concerned about their own political viability. As Mum Stop the Harm writes, it's the result of stigma and lack of will on the part of policymakers, end quote. So my question, Honourable Speaker, is to the Minister of Mental Health and Addictions. When will she expand safe supply to anyone who needs it in this province?
Minister of Mental Health and Addictions.
Thank you very much, Honourable Speaker, and I thank the member for raising a very important question with respect to work that we have done in this province that is ahead of where many other jurisdictions are at with respect to supporting individuals who use drugs, working to create measures to try and separate individuals from the toxic drug supply. We stood up our Prescribed Safer Supply program in the midst of the early days of COVID through our risk mitigation guidelines on the advice of public health officials in order to try to support individuals in the midst of the pandemic and in the midst of the profound disruption that the pandemic brought. We are working very hard with providers, with our health authorities, with physicians, with regulatory bodies to expand the availability of prescribed safer supply. We are adding more and more physicians, and nurse practitioners are stepping up every month to provide those services. We know the regulatory bodies are working, health authorities are working, we'll continue to do that work. We understand the importance of measures to separate people from the toxic drug supply.
House Leader, third party, supplemental.
Yeah, thank you, Mr. Speaker. This government should be acknowledged for taking the first step, but the steps are not going far enough. Data released found that First Nations people are 5 times more likely to die from toxic drug poisoning than the rest of the population. Indigenous women died at 11 times the rate of other women in British Columbia. The First Nations Health Authority said that First Nations people have even worse access to substance use treatment, including safe supply, than the rest of the population. This mass death is the result of policy failures and policies that do not go far enough, and it's disproportionately harming First Nations people. BC NDP government is ignoring the advice of its own experts. The Chief Coroner acknowledged the longest public health emergency in the province's history, calling it a crisis of incomprehensible scale. The Chief Coroner's Death Review Panel asked this government to go further on safe supply through medical prescription and compassion club models. Expanded safe supply and compassion clubs access is nowhere to be seen in British Columbia. My question, Mr. Speaker, is to the Premier. Why has he not supported the expansion of safe supply to stop the mass casualties that we're seeing month after month after month, and in fact year after year after year, Mr. Speaker?
Minister of Mental Health and Addictions.
Thank you, Honourable Speaker, and I do want to just acknowledge the and thank the member for raising the disproportionate impact of this crisis on Indigenous people, and I am grateful to the work that is done through our First Nations Health Authority, working very closely with First Nations Health Council and First Nations and our regional health authorities to identify those gaps in care and supports for Indigenous people that are so critical for us to work on to turn the tide on this on the toxic drug crisis. Since March 2020, nearly 12,000 people have been connected with prescribed safer supply. And in February 2023, over 4,800 people received a prescribed safer supply, and 330 of these were people who we connected to a prescription for the first time. And those are that's a very important a progress in terms of having those individuals in a system connected with care, so that we can continue to support and continue to support that individual on their wellness journey. And I know that the coroner has done important work with respect to looking at how Safe Supply is working, and has confirmed that that Safe Supply is a helpful and important tool, as our public health officials have also advised. Work is underway to evaluate how prescribed safer supply is being offered, and we are working with all of our partners to scale up that program so that we can separate more people from the toxic drug supply.